You might be surprised to learn that people who are sexually active, have a high libido, and engage in frequent sexual activity tend to have healthier hearts. Hello, I am Dr. Habibi, a cardiologist. The story goes back to last week when a 30-year-old man was brought in with a heart attack. When he found out about the situation, both he and his family and companions were upset and surprised. They wondered why he had a heart attack, saying, "He's an athlete, he's a mountaineer. He doesn't have diabetes or high cholesterol. He doesn't smoke and he doesn't use opium. So why did he have a heart attack?" The next day when we were alone, he asked me, "Doctor, could it be because of too much sexual activity?" I asked, "Well, why do you think that?" He said, "I have sex twice a day." It was strange to me too, and this question came to my mind. That's why I went and reviewed medical texts and the latest scientific articles. The results were truly surprising. All the research and scientific studies showed that people who have more frequent sexual activity and have sex at least twice a week regularly are healthier in terms of heart and vascular health. These people have fewer heart attacks. They also have lower rates of heart failure and mortality. And the largest of these studies was conducted in England, where 27,000 patients were monitored for 20 years, and another major study was carried out in Massachusetts, USA, where 7,000 people were observed for 6 years. In all these individuals, those who were more sexually active and had more frequent sexual relations had healthier hearts and blood vessels. They have lower blood pressure and are less likely to develop heart failure and cardiac arrhythmias. The results were very interesting, and I thought to myself that this must only apply to young people. But what's interesting is that the results of these studies show that this is also true for older individuals. That means even those who are over 80, if they have sex regularly, weekly or monthly, the risk of heart attacks and cardiovascular complications is also lower for them. Of course, there is an exception here. This rule only applies if the person does not already have a heart condition. They should not have had a heart attack, and their heart should not be enlarged. For people who have had a heart attack, any kind of sexual activity is prohibited for 2 weeks after the heart attack because it can cause harm and damage to the heart and blood vessels. But after 2 weeks, they need to be evaluated by the relevant physician. If they do not experience chest pain, shortness of breath, or heart palpitations, and if they can climb 2 flights of stairs without any problems, they are permitted to engage in sexual activity. Because the strain that sexual activity puts on the heart is equivalent to climbing 2 flights of stairs. So, in conclusion, frequent and regular sexual activity is not only not harmful to the heart, but actually leads to improved heart function and a healthier heart. Thank you. If you have found this video helpful so far, please like it and share it with your friends. And if you don't want to miss my future videos, please subscribe.